October is Breast Cancer Awareness Month, and the disease remains the most commonly diagnosed cancer among African American women. In addition, the death rate from breast cancer is higher in Black women than it is in white females. However, there has been progress on the research front. Joining me now to talk about that aspect is Michele Cote from the Karmanos Cancer Institute. Thanks for being here.
Yeah, thank you very much for having me.
Yeah, so let's start with the progress. What does that look like?
Yes, well, I mean, we've made progress over the last several decades in all areas. In early detection, with screening mammography, our rates in white and Black women are essentially equal now. We have a lot of great programs in place, both in Detroit and in the state of Michigan, so that if a woman needs a mammogram and doesn't have insurance or can't afford it, there's resources available for her. On the treatment front, it's no longer your grandmother's cancer. The treatments now are oftentimes much less disfiguring. You can have a lumpectomy versus everybody thinks, oh, I'm going to have a mastectomy. They'll have to take the entire breast or both breasts. And that's not true for the majority of women. Yeah. Chemotherapy and radiation also, a lot of effort has gone into developing new drugs and better drugs, and drugs that are just kind of less toxic, so the women feel a lot better during treatment too. Yeah. So, and our kind of final piece is we're now really focused on survivorship, because most women do survive their breast
It's not
cancers.
a fatal disease for most people anymore.
Absolutely.
Right,
most women who are diagnosed with breast cancer go on and die of something else. And so now we're trying to really focus on what do we need to tell these women so that they're not just cancer survivors, but they really thrive after diagnosis.
Yeah, and yet, despite all those advances, we still see these disparities, these gaps between one group of women and another.
Right, we do, and so breast cancer incidence is increasing still among all women, but it's increasing faster among Black women. And in fact, 10 years ago, statistically, more white women, the rates were higher among white women, and now Black women have actually caught them.
Have caught up, yeah.
So that's the bad news. And the other thing that we've realized over the last couple of decades, some of the reason for the survival disparity is that Black women across all ages are much more likely to have a form of breast cancer called triple-negative breast cancer, which is a little bit harder to treat. And so even though white women get the disease too, and Hispanic and Asian, Black women are overburdened with triple-negative breast cancer.
Yeah, and what's the explanation for that? Is it genetic? Is it environmental?
Yeah,
is it dietary? I mean, I don't know.
You hit all
of them.
Right.
Okay.
Yeah, it's multifactorial. Some of it is probably genetics, and there's some great research that's going on, looking to see if we can figure out kind of the ancestral origins of disease. Some of it is definitely lifestyle factors. There's probably environmental factors that we, quite frankly, don't even know how to measure yet that account for it. But it's really been in the last decade or so that we've started to really look at the different subtypes of breast cancer. Yeah. And to focus on the reasons why. Yeah,
yeah. When we talk about these disparities, I mean, I could bring up, I guess, about just about any disease that you could think of, and you'd see a similar gap between African Americans and whites. Is there something peculiar about this gap, though, that tells us how to deal with it differently, or is it just part of the general inequality that we still have?
I think some of it's part of the general inequality that we still have. I think a major problem that wasn't recognized in the scientific field for a couple of decades of research was most of the research that was being performed on white women.
Right.
And so, the treatments were targeted towards the types of cancers that they had, and those that were successful, say a chemotherapy drug going through the pipeline, the greatest success was for cancers that white women tended to have, because that was the focus of the clinical trials. Those were the people who were enrolling.
Right.
So, some of it is, we work really hard, and particularly at Karmanos, where we have a really large African American population that we serve, to, if you qualify for a clinical trial, to talk to you about the clinical trial and encourage you to enroll, so that so that everybody can have equal access to the absolute best new treatments.
Yeah, yeah. October is Breast Cancer Awareness Month. That's become something that I feel like everybody has more awareness of than before. I mean, any place you look, you see the pink. That's part of that month. But talk about the things the progress maybe that has grown out of that awareness month being more prominent. I mean, is that making a difference?
Oh yeah, I think absolutely. You know, that you see it in the media, you see it in the grocery store, you see it everywhere you
See it
go.
in the NFL. I think that's one way that most men, I think, are more aware.
And we talk about breast cancer, and I always, default to saying women, but men get breast cancer too.
Sure.
You know, it's fewer than 1% of the cases, but they are absolutely, everybody's at risk. And I think it's been really, really helpful to just continue the conversation. You know, cancer in the 1950s and 60s, it was a secret. You didn't talk about it. It was whispered. And now you've got people talking to their children about it. It's so important to know your family history, to know at what ages your aunts or your grandma got the disease, and to know both sides of your family, because we've recognized now that there's a couple of genes that put you at much greater risk. And how you get kind of selected before you have cancer to get those genetic studies done is to know your family history.
Yeah.
So we also really promote, if you're with your family for Thanksgiving, try to initiate that conversation.
Well, let's go get screenings, right? Let's go get genetic testing.
Yes. If you have a really strong family history of cancer, or cancer at young ages especially, or multiple primaries, so a person in your family who's had 2 or 3 cancers, which is more frequent than one might expect.
Sure.
Your family might be a good family to get some genetic counseling.
Yeah. Yeah. Quickly, we've got about a minute left. I want to talk about the effect of the conversation we're having about healthcare in the country, and this research and the treatment. I mean, they're sort of coming at it from both ends, I guess.
Right. Yeah. It's an unstable time, to be sure.
Yeah.
And cancer, the other aspect of it that we're studying is the financial toxicity of cancer.
Yeah.
That even with the best insurance, there's costs that you don't think about, and when you're making these decisions about which how long to go for radiation and those sorts of things, you don't know what those costs are at all.
Right.
And so it's a big burden on everybody in society, no matter what end of the spectrum you are at for economics.
Yeah. Okay. Well, congratulations on raising the awareness of this issue.
Yeah, thank you for having us.
Yeah, thanks for being here.